So a lot of these medications for blood pressure, they work really well, but we gotta talk about the side effects of it. Now, the one that I'm gonna be talking about, I've talked about calcium channel blockers, I've talked about ACE inhibitors. The one I talk about is beta blockers, and that one is interesting because we don't really use it for blood pressure initially. Can it be used to help with treating blood pressure? Absolutely, but if someone comes in with new hypertension, it's not the one that I'm gonna reach for immediately. There are some circumstances that I will. If someone has significant palpitations, significantly elevated heart rates, and blood pressure is elevated also, I may reach for that one first because the blood pressure may be elevated because of the high heart rates, but typically I don't use it initially for hypertension. The settings that I do use it for elevated blood pressures, or I use it in general, is if someone has underlying coronary artery disease, especially if they've had a heart attack that led to their heart not squeezing appropriately. In the past, we used to think that you have to be on it lifelong, but if your heart function is squeezing well, you don't have to use it lifelong because it works well, but it also has side effects. One of the biggest ones that people come in with is tiredness. Some of them can also complain of some hair changes, hair loss. The biggest one from the men that I get is decreased sexual activities, some erectile dysfunction like symptoms, and a lot of them are usually on beta blockers, so I try to get them as low dose as possible, potentially coming off of it altogether.